Good evening and welcome to the New York Symposium with Diane Sayre. I'm Diane Sayre and I am an independent candidate for U.S. Senate. And tonight's discussion is going to be an advance on a bit of what we've been discussing before, which is the question of nuclear energy, but not only nuclear energy, but the benefits of this discovery of the secrets of the nucleus, I'll put it that way, for mankind. And before I introduce my very distinguished guests, let me say that participation in this symposium does not constitute endorsement of my campaign. It also does not constitute my endorsement necessarily of what's discussed here, but the point is to have a dialogue to afford voters and citizens of a chance to consider matters that are not normally or often in the public domain. So with that being said, I would like to introduce first Bruce Todd, who people may recall from previous shows. He's a retired millwright with the United Brotherhood of Carpenters, and he worked in all of the nuclear plants in New Jersey as well as 3 Mile Island, and like myself has been a long-time associate of Lyndon LaRouche. Dr. Bennett Greenspan, who was the 2017 through 18 president of the Society of Nuclear Medicine and Molecular Imaging. Dr. Mohammad Khan, Ph.D. with the Fellowship from the American College of Radiation Oncology, and Dennis Speed, my co-moderator, who coordinates the LaRouche Manhattan meetings. Now, to get started, I just wanted to share something that was pointed out to me by my colleague, Denise Ham, who wrote a very wonderful article that appeared in 21st Century Science and Technology about the life of the great scientist Marie Curie and her late husband, and well, they're both deceased, but Pierre Curie, who predeceased her in a terrible tragic accident, and then she continued this work on the discovery of radiation. And they held in Poland on the 100th anniversary of her birth, which the 100th anniversary was 1967, a celebration of her life and discussion. And although this was in the middle of the Cold War, they had top scientists from the United States, from the then Soviet Union, discussing the significance of her work. And what Dr. Glenn Seaborg had to say in this meeting, I think, is very, very relevant for what mankind is facing today, with a global pandemic, which is threatening many of us, with crises in energy and poverty, with 270 million people on the planet threatened with starvation. It is very urgent that we consider the means to solve these problems and not accept them, as it used to be called. My friend Fred Wills, who had been the foreign minister of Guyana and the ambassador of Guyana to the United Nations, had said that the British Empire always talked about the doctrine of regrettable necessity. We just can't do anything. It's just regrettably necessary. And we're so sorry, but we can't get you any food. That is not acceptable. So here is what Dr. Seaborg had to say in his speech honoring Marie Curie. It is the belief that we who are privileged to be scientists, to be engaged in the pursuit of universal truths, are continually obligated to share our scientific heritage and, to the best of our ability, see that our science serves the greater good of mankind. I think we are succeeding in these areas, but I also believe, and I think you will agree, that never before has there been so urgent a need for a stronger bond among the world scientists and for their cooperative efforts in translating scientific progress into human progress throughout the world. Many years before the birth of the nuclear age, to which her work contributed, Marie Sklodowska-Curie wrote, quote, "Nothing in life is to be feared. It is only to be understood," unquote. Today we stand on the threshold of a new age, one in which a greater understanding and use of the nucleus of the atom and its peaceful potential could more than replace the fear in which most men hold it. It could provide a world willing to work cooperatively with an enormous and most versatile force for progress. In some respects, the most remarkable thing about our understanding of the nucleus of the atom, our nuclear science, is its range of influence on other sciences and technology. He said, finally, let me add this thought concerning the internationality of science and man. This is a belief that Maria Sklodowska-Curie held strongly, and one that I think is shared by this symposium. All of what I have projected today that is hopeful and could advance the progress of mankind, all this and so much more could be realized, and perhaps sooner than we think, if we in science could effect one human breakthrough. If we could somehow convince our fellow men that we now live in an age when fear, mistrust, and blind passions based on and regenerated by past ignorance and error must give way to a new ideal of understanding and reason among men. We live on the threshold of a new age made possible by the pursuit of, above all, truth. That is really the purpose of these discussions. So now what I would like to do is go to Bruce Todd, who's just going to give us a short background on the question of nuclear power, the safety of nuclear power plants, and probably address some questions on that matter that many of you have. Go ahead, Bruce.
Okay, thank you, Diane. As Diane had mentioned, I had worked in the 4 nuclear plants here in New Jersey. I live actually about a mile from the Oyster Creek nuclear plant, which is now shut down, and the other 3 plants, Salem 1 and Salem 2, Hope Creek, and also went out a couple of times to work at the 3 Mile Island plant. So I just want to give you a little background on the worker aspects of that. A lot of people don't realize what, in fact, the requirements are for people, just not even, engineers and whatever that work in the nuclear plants, but the actual workers that come in, particularly around the maintenance schedules that go on usually now or every 2 years or so on the refueling and maintenance aspects of that. And that can involve people that don't really even come in contact with the the radiation aspects of that, but it also involves people that do. There's a lot of emphasis on safety. There's a lot of emphasis actually in training, so that the people that work with it actually understand what goes on. And I've worked in all different aspects of that, particularly on the valve and piping systems. I worked on the control rod drives, which are what regulates, sort of like the gas pedal in your car, the amount of energy that's produced in the reaction inside the reactor. So, which requires a lot of much more stringent safety requirements. But there are things that people come to know about and respect and are able to work with because of that. I don't really want to take it much more than that, but I did want to talk a little bit about the Atoms for Peace program, which for a lot of people, they don't know, the original discussion around what became the International Atomic Energy Agency started in 1954. And I'll just give you a rundown real quick on the purposes of that. Was laid out during the Eisenhower administration, but it was actually followed through on the Kennedy administration. Strengthening the hopes for peace was first and foremost, raising living standards throughout the world, integrating atomic energy into the economic systems of all peace-loving countries, improving health and well-being. And this would be accomplished by disseminating information as to the constructive uses of atomic energy, advising groups, agencies, individuals, and others how the industrial and other beneficial uses of atomic energy might be adopted, fostering atomic energy research and development, and encouraging informed local initiative in utilizing atomic energy. Just so people have a little background on that, in 1962, in South Vietnam, there was put into operation a nuclear research power plant. It was called the Dalat nuclear reactor. And kind of a follow-up to what was done with the ideas and the objectives of the Atomic Energy Agency, there were 7 divisions set up in regards to that. There was a reactor operations division, health physics division, radiochemistry division, radiological biology division, a physics division, electronics division, and a training division. And this was occurring in a lot of other countries around the world. The idea being to integrate nuclear power into what at that time would seem like even the most undeveloped countries in the world. In fact, in the case of South Vietnam, they were in the midst of a lot of warfare, even before the 1960s, way back in the 1950s. But the idea was to, as they said, develop the well-being and development of all these countries. And that, so that was the purpose of bringing nuclear reactors, research, and training into all of these countries. Just on a little note, since you were talking about Madame Curie, on a personal note, back in the late 1950s, my mother had come down with uterine cancer. And one of the things that was done for that was what was called radium insertion, which was part of the treatment for that. And despite that bout with cancer and another one, my mother lived to be the ripe old age of 104 years. So this is one of those personal instances where you see the benefits of the use of nuclear energy. And a lot of people don't realize how into their everyday life, radiation is there. A lot of people don't realize it. Things like the porcelain crowns on your teeth have a certain limited amount of radiation to them. If you go camping, which I used to do all the time, the mantle that burns inside the Coleman lantern that you light up is radioactive. So in everyday, or in the bricks in a lot of people's houses, there's radiation being emitted from that. So, it's it's part of everyday life, including what comes in from the cosmos, cosmic radiation. So it's not something that people should think is outside of what's occurring on a normal everyday basis. So I think I'll leave it at that, but that's my perspective from having been on the hands-on part of the nuclear industry. So I'll turn it over to you, Diane.
Great. Thanks very much, Bruce. So I think right now we'll go to Dr. Greenspan, who has a specific work that he's been doing in this field, and he can tell us about that himself.
Thank you. I'm pleased to be here. I'm going to read some comments for everyone. Um, First, I wanted to talk about background radiation, and what Bruce talked about a little bit is a great introduction to what I'm going to say. Life on Earth evolved in a sea of radiation, which was greater in Earth's early history than it is today. The definition of radiation is movement of energy through space. What we're mainly concerned with is ionizing radiation, that is, radiation with high enough energy to produce ions, that is, knocking electrons out of atoms. Currently in the US, there is background radiation to which we are all exposed, cosmic rays from the sun or outer space, our own atmosphere, radioactive materials in the ground, including radon, and radionuclides within all of us, all of which are at very low levels. In fact, some foods have a tiny bit of radiation too, like bananas and Brazil nuts. No harm to people has ever been shown due to this background radiation. Humans have evolved to cope with this environment and have developed multiple repair mechanisms over the millennia. There are over 150 genes involved in various cellular repair mechanisms. The concern regarding radiation exposure is that there is a possibility it could induce cancer. This is certainly known to occur with high levels of exposure. However, no definite evidence of cancer induction is seen below 10 rem of exposure and probably up to 20 rem. The process of cancer induction actually involves damaging within cells. If this damage cannot be repaired, the risk of cancer increases. Ionizing radiation can kill cells at high levels of exposure, and this attribute is used to treat many cancers, many times highly successfully. Low-level radiation, which is defined as exposure of less than 10 rem or 10,000 millirem, has never been shown to produce harm. While radiation can produce harm at high exposures and does so in a linear relationship, that is not true at low levels of exposure. In fact, at levels slightly above the low-level range, probably in the range of 20 to 100 or so rem, there is substantial evidence of repair of radiation-induced chromosomal damage, and these repair mechanisms also repair chromosomal damage from other causes, such as oxygen species, so that the organ or region is actually better off than before the radiation exposure. This is known as radiation hormesis, and a large body of evidence has been documented, especially over the last 10 to 15 years. Due to the repair process mentioned above, it is clear that the linear no-threshold hypothesis, which states that radiation exposure is linear fashion down to zero, that is, that any amount of radiation is dangerous, cannot be correct. And I mention this because many of our regulations are based on that linear no-threshold hypothesis, which is clearly wrong. Now, as far as nuclear medicine, first let me mention that we also have very strict regulations, and we're very concerned about safety. And there are numerous safety practices that we need to follow in doing these studies. Most nuclear medicine studies are mainly diagnostic and use a tiny amount of radioactive substance. These studies have been proven to be safe and effective. These examinations are used to evaluate various bodily processes such as blood flow or function of various organs, and they assist in making diagnoses and evaluating response to therapy. Nuclear medicine studies can help make diagnoses such as many types of cancer, infection, and fracture, and can evaluate extent or severity of disease. A newer technique, known as PET-CT, has become critically important in the diagnosis and evaluation of cancer over the last 10 to 15 years. The beginning of nuclear is fascinating. Dr. Saul Hertz, who was an endocrinologist with an interest in the thyroid gland, was chief of the endocrine unit at the Massachusetts General Hospital from 1931 to 1943. He was involved in studying thyroid physiology, initially in rabbits, with the aim to improve outcomes in patients with thyroid disease. On November 12, 1936, he attended a lecture at the Mass General given by Carl Compton, Ph.D., president of the Massachusetts Institute of Technology, on what physics can do for biology and medicine. Note that this is of 1936. During the presentation, Dr. Hertz spontaneously posed the question, can iodine be made radioactive artificially? I suspect he knew that the Nobel Prize in Physics in 1935 was given for the discovery of artificial radioactivity, That was actually done by Irene Curie, Marie Curie's daughter, and Frederick Joliot. Dr. Compton said he would get back to Dr. Hertz about that and wrote a letter to Dr. Hertz in December of 1936 to say, yes, iodine can be made radioactive artificially. Dr. Hertz was able to obtain some radioactive iodine. His research progressed, and he was the first to use radioactive iodine to treat a patient with hyperthyroidism, that is, an overactive thyroid gland. And he was, so he was the first to use radioactive iodine to treat hyperthyroidism. The treatment occurred on March 31st, 1941, and was the first therapy for thyroid disease in nuclear medicine. We now celebrate Saul Hertz Nuclear Medicine Therapy Day on March 31st. In the last few years, we have been developing therapies based on nuclear medicine techniques that are starting to have a major positive impact. We have used radioactive iodine to treat benign thyroid disease and thyroid cancer for 80 years with great success. However, now we are beginning to treat patients with other cancers, particularly prostate cancer and neuroendocrine tumors, where we have had significant success and can provide improved outcomes in many of these patients. There is now expectation of significant improvement of patient outcomes of many cancers in the near future. So nuclear medicine is clearly an example of where the for Peace program developed a tremendous advantage throughout the world. Thank you.
Great, thanks. And I'm sure people will have questions for you. There's a few things coming in, but we'll go to Dr. Khan first. So Dr. Khan.
Okay, thank you. If I could have share screen privileges, I want to share some slides. Do I have the share screen privileges? Okay, perfect. Yes. Thank you. Can you see my slides?
Yes, now we can.
Okay, perfect. No, thank you. So I'm Dr. Khan. I'm a radiation oncologist. I treat cancer patients with radiotherapy every day as part of my regular job every day. I would like to talk about radiation and how it can improve patient outcomes and save lives. So what is radiation is the first question that patients ask me when they walk in. So I like to keep it very simple and just tell them radiation is a form of energy that's released by atoms and it's used to help society. It can come in various forms like X-rays, gamma rays, neutrons, protons, electrons, and believe it or not, every one of these sources of radiation, we use it all the time to treat cancers. And depending on the form of energy, it can accomplish different things. What you see here on the right is actually a recent young lady that I just treated with a very abnormal, very bizarre disease of her foot. And she didn't really have any options left other than amputation. Her skin was deteriorated from a very rare disease called a syringofibroadenoma. And we discussed her case with many medical oncologists as dermatologists and surgeons, and the only option was for amputation. I stepped in and said, no, I think radiation can help her. And what you're actually seeing is radiation, what they call brachytherapy, which we use successfully to treat her foot. And she's up and walking around doing well and having a good quality of life. So that's another example where radiation actually helped a young woman who would have lost her foot. Instead, is walking around and enjoying quality life. Here's another example. You know, I just went to a dentist a few weeks ago, and I realized they did an X-ray on my teeth. And without X-rays, this X-ray would not have been possible to the dentist. The dentist picked up a small little cavity. This is not my X-rays, but here's an example of other patients' X-rays, where X-rays are routinely used to help dentists in their offices to help diagnose cavities and problems in the teeth before they become a bigger problem, and they intervene and help prevent that. Radiology and nuclear medicine, for example, my colleagues have talked about, like Dr. Greenspan talked about, using iodine-131 to treat patients with thyroid cancer. And here is what I do, which is radiation oncology, and I'll talk a little bit more about it, about what I do with radiation to treat a wide variety of cancers. Here's an example of an orthopedic surgeon. So if you were out playing football, you know, my kids play soccer, if they were to get hurt or something, or if they had broke a bone or something like this, you would go to an orthopedics office, and one of the first things they would do is use X-rays to generate an image of your hand to help them, you know, to figure out which bone was broken so they know exactly where to go and help put it back in place. Cardiologists use it all the time. Gastroenterologists and many others use it all the time to help patients routinely. So what is radiation oncology is the second question that I ask. So I'm going to play, so radiation oncology is a branch of medicine that uses radiation to cure cancers. Up here, I'm going to play this video, an example of a patient that walked into me, a young gentleman with a very bad lung cancer here. So this was a very bad lung cancer on the top of the lung, and there really were no options. It was too large for surgical excision or surgical resection. The patient was having airway issues and really couldn't get other therapies other than radiotherapy. And we treated him successfully. And what you're seeing here is just our modern technology, how we can shape the radiation around the tumor and help get rid of that tumor. Here's another example of another patient I treated recently to help alleviate suffering of a cancer patient. This was an elderly gentleman who came in with a very large lymphoma in the stomach. Patient had difficulty eating, was actually bleeding to the point where he needed lots of blood transfusions, and he probably would have been lost had we not intervened and did radiotherapy. What you're seeing is radiotherapy plans that covers the stomach, and his lymphoma disappeared. And I just saw him this week on Monday, and he's doing wonderfully. And he's eating, he's more alert, and he's basically enjoying quality of life. So not only do we cure cancer, like in the top case, we can also help alleviate suffering of cancer patients to help them from bleeding or pain that cancer can cause, and we can help alleviate that. And then the other thing we can do is not only that, but we can also treat other non-cancerous things, so which I'll touch a little bit about. So before I touch on that, I want to step back in history, because we forget history, and I think it's good to remember this. Patients always ask me, how long have you been doing radiotherapy for? So radiation was discovered in 1895 by William Rankin in his lab. And shortly after that, there were case reports of using radiotherapy to treat successfully things like benign lesions on the skin, even as early as 1896. And if you look at today, more than 60% of all cancer patients are going to need radiotherapy to help either cure their cancer or help alleviate suffering or pain. And if you look at 40% of all cancer cures involve radiotherapy alone, that's a pretty significant percentage of how radiation treatments can help these patients. Here's an example from 1902, where an elderly gentleman who came in with what they call a nodular rodent ulcer. It's what we call today a basal cell carcinoma, right here below his left eye. And back then, he might have lost his eye surgically if they were to remove it. He might have lost a big amount of his skin, and radiotherapy was done. And within 2 years after, within a few months after, his entire lesion is very well controlled. And up here, and on the bottom, like if you see C and D, was another 83-year-old gentleman with similar issue, presented with the rodent ulcer of the left temple. And then before and after radiotherapy, you can see the whole basal cell carcinoma, there's rodent ulcer completely gone. And this is as early as 1902. Here's a young lady in 1903 who presented with a large rodent ulcer, what they call a basal cell carcinoma involving her nose and part of her cheek. She would have had a major surgery. A major part of her nose would have been removed. Instead, radiotherapy was done to give her good quality of life. And within a year later, look at her. She's looking great, looking wonderful. Now, one thing I want to do is, what about 2020? So, 2020, we all saw this coronavirus pandemic come to all of us. We all lived through this. And then what I'm showing here is like, I wish I can travel back in time, and I wish I had this DeLorean that John Fox had, in the Back to the Future movie, where he could step back in time. He stepped back in 1955 and saw what was happening back then to help understand what was taking place in 1955. Here, you can imagine that there was this concept of the flu pandemic in the 1918s. And patients were told to wear masks to try to prevent the spread. This is similar to what we went through in 2020. And I wish I could step back in time to see what people did for pneumonias or infections back in the 1900s. And I actually did do that. I actually stepped back and looked up history textbooks and read what was being done. So as early as 1905, to my amazement, people actually used radiotherapy to treat pneumonia. And this was bacterial pneumonia from 1905 all the way up to the 1940s. Antibiotics were routinely used. And even during the flu pandemic, they were used to treat pneumonias, especially bacterial pneumonias, successfully. And what we did was we understood that this was taking place. So what we wanted to do is to present this and try to do a clinical trial to help our COVID-19 patients. And what we found that within 6 hours back in the 1920s and 1930s, within 6 hours, these patients' x-rays would get a lot better, their breathing, their chest tightness, their temperature, their pulse, their white blood cells, and many other findings would actually improve significantly after radiotherapy. And within 12 to 36 hours, they would start to become normal. And then, and a matter of fact, some of them actually made an argument that their mortality and their overall survival actually improved from 30%, the likelihood of dying from pneumonia, down to less than 5%, and without any notable side effects. So what we did at Emory was start up this trial, and where we intervened, where we did a one-day low-dose radiotherapy trial to the entire lung for COVID-19 patients that were hospitalized and that were dependent on oxygen. And we gave a 1.5 grade to the whole lungs. And we wanted to treat a total of 10 patients with the plan to treat only 5 patients first, and then treat another 5 patients after that. And our primary endpoint was just to show safety and make sure these patients are doing well and not getting worse with radiotherapy. And we had several other secondary endpoints of like getting them out of the hospital quicker, preventing them from getting intubated, and seeing if their chest x-ray shows improvement. So here's what we found. So 5 patients were treated, and out of the 5 patients, 4 of them did amazingly well, where 80% recovered within an average of 1.5 days. And the median age was 90, so these patients were very old. And we published this data, and which sort of, the world saw this and say, oh my God, radiotherapy can actually be used to try to help COVID-19 patients. And here's their altered mental status. So it just shows how their brain functions improved during radiotherapy and after radiotherapy. And then the world saw this, and our data was presented all over the news in many, many media outlets. And now we had only treated 5 patients, and we have to show whether or not we can treat 5 more successfully. So we treated a total of 10 patients, and we compared their data against 10 other patients that got standard of care at that time. And what you're seeing is the 10 patients that got radiotherapy here on the upper right are actually doing a lot better. They're getting out of the hospital in an average of 3 days, versus their control cohorts was taken around 12 days, and this was statistically significant. And the time to hospital discharge was also improved. So our patients that were getting radiotherapy were getting out of the hospital a lot faster, versus the standard of care, it was taking almost 20 days. And lastly, the more importantly, we were able to keep them from getting intubated and getting up in the ICU and having more invasive procedures done. We also had an X-ray readout. This graph is just basically showing you how their X-ray findings in the lungs were also improving because of radiotherapy. And then we went on to do additional trials to further validate this signal, where we've now treated a total of 40 patients. 20 got remdesivir and steroids. These are COVID-19 patients that were hospitalized and on oxygen, and 20 of them got remdesivir and steroids plus low dose of radiotherapy. And they were compared against patients that got remdesivir and steroids alone. And what you're seeing is basically we're sort of almost preventing them from ending up on the tube. So the freedom from intubation was only 86%. So 86% of our patients did not need to get intubated, whereas in the control cohorts that did not get radiotherapy, 68% were free from needing intubation. And we did some other things where we found that we were able to help them get off oxygen a little bit sooner. And if they had a good response based on CRP, they got out of the hospital faster, and their prevent intubation as well. But there's other data from Iran that came out. Iran presented data in 60 patients where some of them were on oxygen and they received 0.5 grade. And the results showed that the response rate was 80%, also similar to what we saw. And 4 out of patients actually improved by 1 day. And they reported that the data was encouraging results. Spain recently published their data as well in patients over age 50, and they also showed that there was potential for clinical benefit if you use radiotherapy in COVID-19 patients. And I won't go into too much of this, but this is just data from Gustave Roussy in France, where it did experiments in mice, where they took little mice and injected 3 different sort of ways of generating pneumonia or ARDS in the lungs. And they gave them varying doses of radiotherapy, and they were able to show mechanisms what were happening after radiotherapy, where they showed that IL-6, which is involved in inflammation, was reduced, and interferon gamma was reduced, which is also involved in inflammation. And then IL-10, which is anti-inflammatory, they were able to show that radiotherapy causes anti-inflammatory effects. And so this just sort of drives the point home that in the older days, radiotherapy was used to treat pneumonia, and we're able to use this today to cause anti-inflammatory effects. And if this is true, the anti-inflammatory effects could be used for many other entities like Alzheimer's today, arthritis today, and there's already work on going about using radiotherapy for treating like this. So I think there's a lot of potential opportunity to keep advancing the radiotherapy to help mankind. And so with conclusion, I would like to conclude with saying that radiation helps, saves lives. Radiation improves quality of life. Radiation is a blessing to society. Radiation is a big part of medicine today. And fears about radiation keeps us from advancing its power. And radiation can be a great tool if used in the right hands. Thank you.
Great. Thank you very much. I actually have lots of...
that's what I had to present.
Okay. I have lots of questions, and also people here on the panel may have things, and I'd like to bring in Dennis Speed. I think there's been a few things posted. There's an announcement on the in YouTube and so on, but in the chat. But Dennis, why don't you go ahead?
Yeah, I'm having a little bit of a problem getting into the chat, but let me just say the following, because as do you, I have a few questions. One thing, Dr. Khan, is that we were having a little bit of a problem on your audio, and when you got to the slide where you were talking about radiotherapy benefiting others, we heard part of it. We could see the slide, of course. You were giving different examples around things like Alzheimer's and so on. But I want to give you a chance to say something a little bit more about that. And secondly, I noticed that you reported about correlate projects in Iran, Spain, and then differently France. And I guess the question I would first ask you, in conjunction with your elaborating on how this can help others, is how do you see the possibilities of international cooperation? I mean, obviously, that would be going on anyway, because there are people who have labs and there's a certain amount of discussion. But what could be done to perhaps augment that and create a kind of a process of protocols among nations, which could give us even quicker, shall we say, research results that might give us some idea of new pathways we could take, whether that's about COVID or any other disease?
No, that's a great question. So I will answer the first one and then take the second one. So the first one regarding low dose of radiotherapy, and the whole hypothesis behind the cytokine storm in COVID-19 was low dose of radiotherapy can shut down inflammation. And we've shown that in our clinical trials, and other trials are ongoing. And if we can do this, and if you look at lots of clinical entities that we treat every day, like Alzheimer's, arthritis, are inflammatory mediated processes. So we can tap into that and help reduce that. In the US, there's a lot of barriers to want to do those radiotherapy trials because of the fear of radiotherapy, which is really not scientifically founded, based on evidence and data that was talked about in an earlier lecture. So I think low dose of radiotherapy, the benefits of that may outweigh the long-term risk of secondary cancers. So that's number one. The second question becomes on an international level, how can we sort of get together and work together in the United States with US government support and with other international agencies like IAEA and the WHO Health organizations. And I do understand that IAEA is doing radiotherapy trials, especially for like cervical cancers. And I've known people that are involved in IAEA in trying to do cancer trials that would help third world countries. So cervical cancer, for example, is a very common cancer in parts of Africa and parts of the other world. So they're doing an amazingly good job of trying to roll these trials out there. And because it's cheaper, it's much more cost effective than compared to some of the drugs. And for example, this therapy that I was talking about, low dose radiotherapy for COVID-19, would be a lot cheaper in the third world and other parts of the world than would be other drugs that are currently being used for these patients. So I think this is where it would take international coalitions to get together and saying, hey, we want to advance these new areas that are needed for mankind in a cost-effective manner. And I think we could rise to the occasion collectively across the world. And you're seeing data from France, you're seeing data from Spain, from Iran. I've heard of data from Mexico, and I think there's data from India that might be coming out. I understand there's an international aging society that's running a same trial, COVID-19 trial, across, I think, 26 different countries across the world, including Canada and many other countries. So that's amazing to see that sort of coming together, the world working together to help advance the role of radiotherapy.
Okay, I just also ask one other question, which is for Dr. Greenspan. And just the following, could you, for, people I think don't understand the electromagnetic spectrum, the idea that, in other words, there are all kinds of areas of life in which radiation is not only used, it's something that people fight about using. And if you could just say something a bit more, you referenced cosmic rays, you referenced, of course, other forms of radiation, ground radiation, and so on. I think also Bruce referenced that. But could you sort of state or elaborate a little bit more why it is that people should not be afraid of something that they're actually using all of the time, and some of the different forms in which that can be made clear?
Yes. Well, let me start by saying that there's an electromagnetic spectrum that goes from radio waves on one end to gamma rays on the other end, and they're a type of radiation also, but they're non-ionizing, and so they're harmless to people, and we use them all the time to listen to the radio and so on. And then there's the small range in the middle that has for light, visible light, and that, of course,
Uh-oh, is he frozen?
So it looks like we're having a problem. Should we contact him some way?
Yeah, he'll probably notice it, and
Yeah, maybe we should just continue and then
yeah,
come back to him.
yeah.
So you have any other, I mean, I have other questions, but I figured I better go back to you.
I have about 1 million questions. And first, let me just say that our Jerry Cutler, who was on before, I guess he's going to hang up and get back in, on nuclear power, just put a note that and works on this. Next Wednesday, the paper on his clinical trial on patients with severe Alzheimer's disease will be published online. He said, we did CT scans and observed remarkable improvements in cognition and behavior. So I think that's very promising. Alzheimer's is something which is devastating to families and to, I don't know, probably millions of people. So my questions are, is there a relationship between cancer and inflammation? Like, why does this have an effect on cancer? And I realized that I had, the image in my mind, which I'm sure is created by this propaganda, is you think of radiation as like some kind of zapping thing that just kills things, as opposed to what probably is actually going on in this process. And then perhaps related to that is the question of, clearly there's amounts of radiation which are beneficial, and there's such a thing as not enough and too much. And how do you determine that? Those are the first two, and I have many more, but now Dr. Greenspan is back with us, so I'm not sure if we should do that or let him.
I didn't hear all the question because my computer closed down.
Yeah, well, right. I mean, if you might want to try to, you were beginning to answer the question and then you kind of froze up on us. So we let you go ahead with that first and then maybe go to what Diane just asked.
What I was trying to say is that people have images of damage or whatever from high levels of radiation and extrapolate that down to any radiation is dangerous, and that's clearly not correct. Nuclear medicine uses tiny amounts of radiation for clinical studies, and we're always very careful and cognizant of the safety factors involved. And in radiology, we do CT scans and so on to make diagnoses, and those are done with safety in mind also. So it's providing a benefit to patients without harm. And in radiation therapy, as Dr. Khan showed, they produce a tremendous amount of benefit. So there's a lot of good we can do with it if it's used properly and carefully. So people should be more aware of that. And like I said, there are strict regulations throughout the field, the radiation field, whether it's in nuclear power or in the medical areas, throughout radiology, nuclear medicine, and radiation. We're very careful of doing things with safety in mind and for safety of the patients and for their patients' benefit.
So Diane, you might want to repose what you were saying.
Well, I'd asked whether there's a relationship between cancer and inflammation, or how does that work? I'm curious about that.
Actually, there is.
Sure.
Long-term inflammation can cause cancer, and cancer causes inflammation. And in fact, one of the thoughts now of treating cancers is to reduce the inflammation that it causes surrounding the tumor. But that's a very new discovery in the field. So they are interrelated somewhat. It doesn't mean that all inflammation causes cancer. It doesn't. But there is some relationship in both directions, that inflammation can cause cancer over a long term, and cancer can cause inflammation surrounding the tumor, like in lung cancer, for instance. And some people are actually treating the inflammatory process around the lung cancer with some success. I hope that answered the question.
Yeah. Did you have more on that, Dr. Khan?
I don't know if he knows your.
So
Yeah.
I agree. Can you hear me?
Yes, now we can.
Now we can, yes.
Okay, I apologize. My internet is a little unstable too, I think. So radiotherapy is basically where we use ionizing radiation to either destroy a tumor at very high doses of radiotherapy. So for example, a lung cancer patient, a breast cancer patient, a prostate cancer patient, we will give them 6 or 7 weeks of radiotherapy where we're intentionally causing damage within the DNA of the cancer cells. And therefore the cancer cells do not repair and they undergo death. And then your normal tissues around it repair and generate. And that's how we take the biology into account and help destroy cancers. But on the other end of the spectrum, where we're using very, very low dose of radiotherapy in that single 1-day fraction, for example, the COVID-19 was a single treatment, less than 10 minutes. It's so little that your immune cells, like your inflammatory cells that are in there, are so sensitive to radiation that they disappear. So it's basically like resetting the immune system and removing some of the problem that's being caused by the inflammation. And that's why low dose of radiotherapy can be anti-inflammatory. And that was a hypothesis that drove us to do the COVID-19 trial, because when those patients started in February or March and our hospitals were being shut down and we were being overwhelmed by COVID-19 patients, there were no therapies available for those patients. So we went back in time and redirected what was done in the 1920s of low dose of radiotherapy helping pneumonia patients. And we then did that to help our COVID-19 patients. And it's just a matter of what dose of radiation use. Very low doses are anti-inflammatory. Very high doses are ablative, where we can destroy cancers. As a matter of fact, it works very well with immune checkpoint inhibitors and even the therapies to further advance the cancer treatment beyond what it is today into the future.
Oh, by the way, Dr. Khan, just a point of information, the DeLorean that was being driven by Michael J. Fox was powered by plutonium. So just that to be remembered. I also
Wait,
wanted
I
to
have
ask,
another, wait, on this, I just want to ask, because you said we had to go back in time and look at the 1920s and the treatment of pneumonia with radiation. Does that mean we have not been treating pneumonia with radiation lately?
That's right. We haven't.
That is correct. We're
Wow.
not using that anymore. Yep, that's correct. We're not using that anymore, and because of the fears. And matter of fact, my work that we've done here at Emory has now asked other people to think about pneumonia that's bacterial resistance that does not respond to the bacteria. The question becomes, can we use radiotherapy for those patients? And that's the question that needs to be.
Right.
Diane, do you have another question? Or?
Yes, and there's also one in the chat, which I'll just ask. And well, maybe I'll go to my question, then there's one in the chat too, which is also for Bruce, because one of the big things about nuclear power that everyone always brings up is the waste, the waste, the waste. What do you do with the waste? And of course, I know that up to 96% of it can be recycled or reprocessed if we care to do that in high temperature reactors. But I think a lot of what's left after that can be used in these medical areas. Is that the case? Is that accurate?
Bruce still on?
Bruce, yeah, he unmuted and then remuted himself. You're muted, Bruce.
Okay. I think the other two gentlemen could probably answer that better than I do, but I've constantly discussed that issue with people about, the whole, in fact, I was talking with somebody recently and I said, I think we should rename what is now called nuclear waste, because clearly it is not waste. And I think the better term would be spent fuel recycling, maybe a better term, which would fit in better. Obviously, we can, take what is really a small amount of spent fuel now and reuse it. In fact, I was just thinking about when you were talking about the Michael J. Fox with the plutonium-powered car, the fact that the Voyager 1 and Voyager 2 spacecraft, which are plutonium-powered, are now way outside our solar system in interstellar space, headed for who knows where, still working very well from, I think, what is it now, 60 years? Without a glitch. So that's obviously one of the potential uses for what's the spent fuel. It could actually power. I mean, think about John Kennedy when he went to Congress and he said we should start taking longer strides, and he was referring to the space program, and he was calling on Congress to fund a nuclear-powered rocket, which was ready, actually had gone through all the trials and was ready to go into production. And in 1972 was stopped dead in its tracks and never used, even though it showed a potential to have twice the lift power of the space shuttle program using chemical rockets. So we've got all this spent fuel, which can be recycled and potentially power spacecraft, going, taking us maybe to Mars, maybe even powering cities on Mars. So yeah, there's a lot of benefits to what is now considered spent fuel.
Should I ask the question from the chat? Probably a good idea. And this question is from John, and he asks, exactly why or how does radiation therapy have these beneficial effects? What exactly is going on?
Sure. So I can talk about that. So radiotherapy, like I mentioned, destroys the DNA of the cancer cells and has to do with ionizing radiation, where radiation therapy goes through the cells and causes oxygen radicals to be formed, and those oxygen radicals interact with the DNA of the cells and causes double DNA strand break repairs. And those double DNA strand break repairs does not repair itself within the cancer cells, because the cancer cells do not have repair mechanisms as the same level as the normal tissue. Therefore, those cancer cells die off. So that's how radiation takes advantage of the normal tissue differences, whereas the cancer cell differences. And more importantly, my recent papers and many other papers from other labs are also showing that radiotherapy engages the immune system and actually helps the immune cells to also move in to the environment around the cancer cells and wipe them out. It can help your CD8 T cells, these are immune cells, to move into that environment where the cancer cells are and help your immune system also to eradicate the cancer cells. So there are many, many beneficial, positive effects of radiotherapy by which radiotherapy leads to cancer death and eradication of cancer while trying to spare your normal tissue and allow your normal tissue to regenerate.
Okay, Diane?
I was wondering if Parkinson's is something that this has been applied to, or is there work in that as well?
Yes. So the reason I put Parkinson's on there is one of the things about John Fox, he actually has Parkinson's, and I think that was something that was on the Wikipedia when you're reading through the Google, and I think that's something he's come out with. And Parkinson's is a tumor. It's a movement disorder where patients that get elderly, they have problem with sort of movement-like abilities, and they can't control their movements. What we're finding is part of where that originates is in part of the brainstem. What they call substantia nigra is this area that's in the brainstem that a lot of people are looking at as for some of the essential tremors that takes place in some of these patients. And there is actually work with radiotherapy using gamma knife procedure. These are very large dose of radiotherapy, but centered to a very, very small area in the brainstem, where and there are some good data of radiotherapy working to help patients with movement disorders and reducing those. But that data is still early and small, and I think this is where research is ongoing right now to further advance that ability of gamma knife and other radiotherapy ablative type procedures to help improve patients' outcomes, especially improve their tremors. So I think there may be a role for Parkinson's in the future, but certainly for essential tremors, it is being used. And I know some of my colleagues up here at St. Joseph's have actually used that successfully, and other hospitals that I'm aware of have used it successfully to treat patients with essential tremors.
We have a question from Jose. Actually, he's also has a correction. He insists it's Michael J. Fox, unless the J means John. He said that but then of course some of us just agree on Marty, since that was his name in the film. But what he asks is, he says to you, Dr. Khan, how much more efficient has radiotherapy become since chemotherapy?
I'm sorry, I missed the question. I think, can you repeat that?
Yeah, he's asking a question that may not be clear. He asks how much more, well, he asked really two. How much more efficient has radiotherapy become since chemotherapy? And then asks, how does radiation affect muscles in the body?
Mm-hmm. It's a good question. So radiotherapy has become very, very efficient with modern technology and modern capabilities. So if you look at one of my first slides, I talked about proton therapy. So proton therapy is very, very precise, and we can spare a lot of normal tissue and really direct the radiation where it needs to be. So it has come a long ways. So the current patients going through head and neck radiotherapy, lung radiotherapy, gastric radiotherapy are having much, much less side effects than their predecessors were about a decade or 2 decades ago. So I think radiotherapy has become much more efficient, much faster, and much more conformal. The muscles are being spared and things like that. So I think, I think we made tremendous amount of progress over the last 2 decades when it comes to radiotherapy.
Okay, Diane?
Well, did Dr. Greenspan have anything on that you want to say?
Not really.
Okay. There's a question, I was sort of wondering about this too. Well, really, the questions of things, tuning, Art raised the question of something called optical biophysics that Lyndon LaRouche spoke of a lot in the 80s. And he's asking, is this related to low dose radiation? Or is it the same thing? Or
I don't know much. I'm not sure what he means by optical biophysics, but I doubt it's the same thing.
yeah.
Low dose radiation means the level of ionizing radiation lower than a certain level, and by definition, it's an arbitrary definition, but the definition is less than 10 rem or 10,000 millirem. So it's a certain level of exposure below which is called low dose radiation. And like I said earlier, that there's no evidence of any harm to people at that level of exposure.
Mhm.
So my
What
guess
is
is
REM?
optical biophysics is different.
What does REM stand for? What is that?
It actually stands for radiation equivalent man. The unit of exposure in air is the Roentgen, and named after William Roentgen. And then there's an exposure in tissue which is called rad. And if you translate that into exposure in people, it's equivalent man or men. And so that's the it's supposed to equate to the damage in tissue, whereas the Roentgen is exposure in air. And so it's and the rad and the rem are relatively the same. So you can basically use one interchangeably with the other, because our measurement of damage from that is loose enough that you really can't tell the difference.
Okay. Now, another question that comes to mind. So you said that they were using radiation with these beneficial results in the 1920s, and then it was discontinued because of the fear. Was there a particular point? I mean, when did this fear become a big factor in preventing them from using something which seems to be so effective?
Well, I would be guessing here, but I think part of it had to do with the fact that people started seeing damage from using radiation, making X-rays in the 1940s and so, and 50s. And then with effects from World War II, people said, oh no, this stuff's dangerous, we shouldn't touch it. And well, I agree that nuclear bombs are dangerous. The radiation we use in medicine is very safe and very, very beneficial, or we wouldn't be using it. I mean, our purpose is to help people, not to harm them, and to cure diseases or evaluate diseases, not to cause diseases. Now, there are some side effects, but in general, we're doing beneficial things for people in detecting disease, diagnosing disease, evaluating disease, providing prognosis, and all sorts of things like that, with tiny amounts of radiation that are negligible. And now in radiation therapy that Dr. Khan does, these are higher levels that are used for treatment. So there's a difference. But there again, they have very strict safety standards, and they're very careful in how they do it. It's aimed very carefully. So again, they're producing beneficial results, and those vastly outweigh the potential risks. But you can't really equate low levels of radiation where there's minimal risk or negligible risk with high levels where there could be some risk, but not very much. And then much higher than that, nuclear weapons which really aren't part of this discussion, frankly, because their purpose is to hurt people. We're not trying to do that.
There have been kind of a couple of different questions or formulations of this question. So I just ask it, which is there, Dr. Khan and then Dr. Greenspan, both, how did you get interested in these fields and why are you doing it? I understand, Dr. Khan, you were a nuclear engineer before you became a doctor. Is that the case?
Yes, that is correct. I was a nuclear engineer and I was learning about nuclear physics and how to make nuclear power plants. And while doing that, I learned about the wonderful world of medical physics and health physics. And I started going down medical physics and health physics, where I realized I could use radiotherapy to help mankind. And while doing this, I realized, oh, wow, there's a radiation oncology world and even a radiology world where I can sort of further get to the patient bedside and bring it to the patient bedside with the full in-depth understanding of the radiation principles. And that's how I sort of evolved myself.
And Dr. Greenspan?
Yes. Well, I went into medicine because I thought that would be something where I could provide benefit to patients. But throughout medical school, I generally didn't find anything that really excited me. And until I did an elective in radiology, and I realized, man, this stuff is fun. It has some physics in it, which I like, and it was essential for almost all patients. Almost every patient in the hospital is getting X-rays or nuclear medicine studies or something related, and some of them get radiation therapy. And so I pursued training in radiology and also nuclear medicine. The field ever since, and I really enjoy it, and I enjoy the physics part of it too.
Okay, back to you, Diane.
Okay, there's another question in the chat, very important. Will or can radiation be used to slow or reverse the aging process?
There is a little bit of research in that area. I'm not very familiar with it, so I can't say much more than that.
Well, if one of you wants to tell us that you're actually 137, then we'll.
Gotta be careful with that. You may end up like Robert Lansing in the 4D Man. That's showing my age, but for those of you who remember the movie. he was interested in it, but he did it the other way. So.
Well, I will ask, and then perhaps we should wrap up since I try to keep these to approximately an hour, but maybe for everyone is what do you think can be done to cut through this fear? Because it seems we're really missing out on something which is extremely beneficial. And even people are dying because of fear of this kind of technology.
Boy, that's a really good question and a really tough one to answer. I think just trying to talk to people and help them to realize that much of what we do in medicine is beneficial and for the patients and for the benefit of the society. And at least what I'm doing, what Dr. Khan's doing, are helping patients and making diagnoses and helping treat them and helping improve their quality of life. And that's our goal. And we're generally pretty successful at it.
Bruce or Dr. Khan, do you have anything you want to say either to that or in conclusion?
Well, I would just say, having worked in the nuclear power industry, people are seeing nuclear power right at the outlet of their house. When they want to turn on the lights in their house, they want to have the refrigerator run. Nuclear power is a great way to do it.
I concur.
Yeah, no, I agree with Dr. Greenspan and all the comments stated about the wonderful things that radiotherapy and radiation in general can do to help patients with their medical ailments, as well as help generate energy and electricity for the world. So lots of potential opportunities of using radiotherapy to help man.
Great, thanks. Dennis?
I would just say that if it's possible, it would be good to somehow create the basis to have a kind of symposium, something longer that we could allow members of the public to participate in a more general way. This was not bad. We had a few people in the chat, but it just occurs to me that just in the short time we've taken here, you've dispelled many misperceptions, but there may be the basis to really hear a lot more about this. So I just want to thank you for what you've done here, and just indicate that maybe there's a way to, together with maybe a few other persons, scientists and others, researchers. And I'm very interested in this idea about the international side, the fact that there is that kind of collaboration and that these results are being registered in other nations. I think it might help a lot in the present circumstance in which the tension concerning coronavirus and so on could be overcome just by, real groundbreaking, exciting research and sort of getting the public mind involved and fascinated in the possibilities rather than the liabilities of our present circumstance. So just want to thank you for saying what you said and doing what you're doing.
Thank you.
Great. So I would also like to thank everyone, Bruce, Todd, Dennis Speed, Dr. Greenspan, Dr. Khan, and to tell all of our listeners, the Friday symposium is going to continue at 7:30 p.m. Next week, I believe the topic is education, and there will be also some discussion of international situations. One of the educators who will be talking with us spent some time in China, so there'll be a comparison in terms of the differences between what goes on there, what goes on here. And I would like everyone to know that my campaign is working to recruit some younger leadership, people between the ages of 18 and 35 who want to not wave pom-poms and do mindless things, although sometimes there are sort of mindless tasks that we have to do, but work on heavy ideas and read Shakespeare, Plato, Kepler, etc. So if there's anyone watching who's interested in that, please private message me on Facebook or contact me through the campaign, sareforsenate.com. And I want to thank everyone again. And perhaps I like Dennis's idea. If there's a potential to do something a little bit of a broader forum with more public participation where we can dispel some of this fear so that people can actually benefit from scientific progress, I think that would really be excellent. So thank you very much. Good night.